Hello, dear colleagues, how are you? My name is Berdikhojayev. My assistant, neurosurgeon Rowan Ayteli. And we are from Presidential National Hospital in Almaty City, Republic of Kazakhstan. It's in Central Asia. And now we have a patient number 2 for today. The first case we couldn't live stream because of internet issues. The hospital under deep reconstruction. The only one building will be left, and the other buildings will be destroyed. And we're expecting the new buildings in next 3, maybe more years. And now I hope the internet is okay. And the case under local anesthesia. A young lady, 39 years old, with multiple aneurysms. This is the right side. On the left side, it looks like more infundibulum, but on the right side, approximately 7 millimeter irregular shaped aneurysm, with the PCOM coming from the neck region, and the choroidal aneurysm, the artery is coming from the neck part. It's unruptured. Басыңыз ауырады ғой, да? Has ауырмайды ма? Okay, no headaches now, but it was some reason to go for the MR. And patient has a ACOM. It's not so nice, but it's in place. Let's see from the beginning. Vertebral artery, right side. It's okay, no problem. The carotid, you can see one aneurysm, second one. Not a clear ACOM, but I will show you later. There is something coming. Okay, the venous phase, some pachionic granulation hyperplasia might be, and venous phase. The 3D. It looks like there is a contralateral ICA. On the 3D you can see there are second ICA. It's a meaning that there is a ACOM artery. Aortic arch, left side. It looks like microaneurysm, but we analyzed the MPR. There are arteries coming, that's why now we will count it like infundibulum, but we will closely follow these segments. And then we have these two aneurysm-like dilatation on the left side. Yes, on one of the images you can see the washout. It's washing out from the contralateral side. It's a good sign that we can take it in account when we will start to deploy the silk stent, and vertebral system is normal. Okay, now we have this image. I think we will use this image for the stent deployment. 4.6 at this point, 3.2 at this point. Yes, the proximal part. The proximal part is 3.7. This part approximately 4. That's why we asked for the Vasco 18 plus, which is 21 microcatheter. Nowadays, the Headway 21 Headway microcatheters are not available in the department because of the some tender papers problem. We will do this case. No, we are planning to do this case with the Vasco 18 plus, which is 21. 8 French short cheese and a Klingber guiding catheter, 100 centimeter, Judkins right. 4.0 Y connector, the second one. and Chikai regular with the Vasco 18 plus. Okay, let's go for this projection. This projection is more friendly projection, 45 degrees. Okay. Korkpay jata berіңіз, жақсы ма? It's a local anesthesia and the operating nurse Bachit, the second nurse Akıl. The anesthesiology nurse now changed, Laura. And the video stream support today is very powerful. Evgeny Grishayev, it's a video on KZ company. And now our guiding is just at the orifice of the ICA. We took microcatheter with the Shikai regular. It's ophthalmic segment now, and we should go to the M1 segment. On the way we have a aneurysm communicating part and the choroidal. It's the first challenge. The second challenge is to place the stent just at the bifurcation, and the choroidal aneurysm is very close to the bifurcation. With the fret is usually very easy. Technically less complicated. I'm trying to avoid the word sentence easy. There is nothing easy in endovascular. Technically less complicated if we use fret extent, because of the flared ends and the stent at the end, 3 mm, which is very comfortable. But with other braided flow diverters, the flow diverter starts immediately. That's why we need to be very precise. And it's challenge number 3 is a Vasco microcatheter, which is less friendly. It has a headway or phenom or rebar. Okay, 4.5 by 20 is a silk vista. Okay, sometimes possible to place coils inside, but in this case we will try to do it without coiling. Okay, it's possible to cover the small part of ACA. I think it would be not so problematic. We'll see. Italy. Қиналып тұрады. Васка 21-ден жақсы көруші. Жеңілдеді ме? Жеңілдеді ме? Абсолютно. Okay. Yes, it might be a little bit challenging, and also I injured with the Neuroslider 21 combination with Silk Vista. It was approximately 3 weeks ago, and now I have a pain when I'm moving my first finger. Yes, it was really painful procedure. I hope this combination Vasco 18 and Silk Vista will not hurt me because of the big tension inside. Yes, as I have seen from the Professor Saruhan Çekirge, he is using surgical clamps, mosquito, for this reason. It's really frictions. Maybe we will ask for 21 microcatheter. think the repositioning will be complicated. Okay. Бақыт, дәулет Шайковичтен Васко 21 соқ келе салшы. Васко 21. Дәулет Шайковичтен. Okay. Let's take it. It's really painful for me. I have a pain in this joint and it's not recovering. Now it's approximately 1 month, not 3 weeks. It was at the beginning of the May because of the lack of material. Tartar. Yes, because of the lack of material, I should work in not so comfortable position. Tartar. Хат тартып, жай тартыр. Тартыр. Тезірек тартырсың. Жай болған кезде айтам. Тартыр. Енді жақын oldu. Тартыр. Так, стоп. Қарашы, стенд өтіп кеткен жоқ. Шықпады. Тартыр. Тартыр. Енді келе жатыр. Тартыр. Тартыр. Все, шықты өйдем. Тартыр. Чуть-чуть еще, все, стоп. Okay, we will change the microcatheter for the 21 plus. 21 plus is not 21, but then it would be easier. Бағана болған. Жоқ, ол болмайды, ол точно такой же. Okay. Let's flash it. Okay. Yes, I had experience of deploying the Vistas through 21, but through the 18 I hadn't. There's a lot of friction. Бар ма? Қазір мынаны күте тұрайық, егер болса. Okay. Let's leave it here. Yeah, осыны бері салшы. It's a 21, yes. Сыртын көрсетші. It's a 21 MP. Okay, which is 24. Okay, let's use this one. Never did, no, never. Okay. It's again the problem with the instrumentation, and this year will be in a permanent manner. The problem will continue till the end of this year, maybe for the following years. That's why we should adapt for this situation in Almaty. I especially limited the number of patients in Almaty Presidential because of this reconstruction of the building and also lack of the quotation. Yes, now we are in the M1 segment. I think it's enough. Oops. Su var hangi zeytin? Где-то один, да? Сейтер. Yes, with this microcatheter, the silk vista goes easily. Yes, 18 is not for this purpose. It's like a narrow slider. But this is 24 microcatheter. It's not 21. Let's check. Yes, it's very nice stagnation. Чуть-чуть минус хуже. I think it's just at the level of bifurcation. Now we should check the position of the choroidal one. Okay, let's see which projection is better. It's like this 22, 28 caudal. Right, 22 and 28 caudal. Okay. Let's take it out. Okay. Sen geçirirsin. Yes, iyi geçirirsin. And it's inside the aneurysm. We should cover the ICA. I think we didn't cover the distal part. We should place it a little bit distal. Smart mask also. Так, минус, стоп. После smart mask. Okay. No, it's more inside the aneurysm. It's all inside the aneurysm, no? But aneurysm start stagnating. I'm not sure it's really inside the aneurysm. It's like we are at the wall of the... Okay, let's deploy it more. Okay, and let's check in at 45 degree. Yes, that's quite nice stagnation. Let's check. Yes, the both aneurysm are covered. Well, on this projection, ICA is not covered. Huh? Just a second. Let's do it like this. Huh? Let's do it left. Let's check it. Yes, we covered the one segment. Huh? That's why it's stagnating. Yes, we covered the one. Okay, let's start in M1 segment. Maybe a bit distal, yeah? We need to be a little bit distal. At this point, okay. Smart mask. So, a little bit too much, and now maybe better. I'm trying to avoid the intimal hyperplasia in long term. Not the intimal hyperplasia, the fish mouthing in the long term. That's why trying to place as much as in a straight segment. This looks like okay. We have approximately 5 millimeters distally. Just a second, one more time. Okay, now I think I hope it's okay. Okay, now it should be better. I'm trying to open it without compression. Yes, it's too close, the choroidal aneurysm, to the bifurcation. Ну-ка назад. Стоп. Вперед. Стоп, смарт-маск. Okay, let's try to do it in this projection. It looks like recovered, huh? No, alındı. Yes, no. This looks like better. Okay. Okay. Now we deploy the stent. Yes, both aneurysms are stagnating. We tried to not cover the ICA territory. I hope it was possible. Yes, something like this. Okay, let's see the projection in which we have seen clearly the right side, which were 22 or 23 by 28. Назад. Стоп. Yes, we didn't cover the... It looks like partially we covered the aneurysm, but maybe better to place something else, huh? But the aneurysm is covered, means I prefer to place something else, huh? But there is a stagnation inside the aneurysm. Yes, we bridge the neck. Let's see. Measure diameter ölçülür. Measure değil, measure. Üçte 18 korsatıyorsunuz. Leo baby. 318. 318. А, угу. Так, 3-8 годин. Все хорошо. Қанша көрсетіп отыр бұл? Қанша? Стенд тұрған жер. Вот сол жерде диаметр. Внутренний сонный диаметр. Ортасында. О жер. Sure, measures. Okay, we have a 3x18 Leo baby, which maximum could be enlarged till 3.8. Так. Или солай қалдыра саламыз. We have a dilemma. If it would be enough to leave it like this, or we should place anchoring stand. It's better to anchor, huh? Stop. It's stagnating, but aneurysm is partially covered with the stand. Because of the anatomy. Just a second. Let's see. What's the image? Okay, this one is very important. 4.6. The Leo baby will be enlarged till 3.8. This part might be, this part also okay for Leo baby. .7. Maybe better to place Leo plus 4.5, huh? It's stagnating.
Yeah, stagnates a lot.
Окей. Ваза сети деген қоясыңшы. Ваза сети. Okay, let's do Vaso city with hand injection. Vaso city IV. Vaso city AI. Okay, upstairs. Ташпулаттың кабинетінде Лео шарым жоқ па екен? Может, на хранение қалдырып кеткен Лео болса? Итере бер. It's a Vaso city, it will be like this. Okay. I took a 5 cc of contrast and 15 cc of saline. Let's see how it would be at the end. Екінші даган тартыр. It's possible. It's possible. Okay. Instagram. Okay. Possible. I think now we need to cut. Okay. Cut outside. Okay. Now we need to cut this part. Okay, let's take this part. Cut outside, cut. Now it's possible to see how much it's covered. Huh? It looks like we covered. Yes, it's nice. Қалай стаж болады, қалай? Случайно хранение қалдырып кеткен шарым жоқ па?
Фирмада жоқ.
А мынау не нәрсе?
48 и Пегас.
Пегас. Ладно. Қазір көрейік. Пока ән жүр, қойып тұрмыз. Жоқ, онда жоқ. Okay, it's end by end.
Yeah.
It's end by end. Now it's look like we covered. It's look like we covered. It's just end by end. Okay, let's see the MPR. Okay, there are another one option. I think it's called segmentation. No. This. Device. Okay, to the rest. No, this one. No. This. Короче, бір expert guide. Бір опциясы бар. I think it was segmentation. Let's see. Only question is how much we covered the neck of the aneurysm. This is device. Device is perfectly opposed. Yes, it's end by end, huh? Okay, let's see the NPR. It's a upper, it's a lower. Let's this is edge, huh? This is edge. Just millimeter. Huh? Okay. It's not like we covered the aneurysm. Okay, let's see one more time. It's a 14 minutes from the beginning. Now we may control the DSA. It's maximum. Okay, let's check it. It's end by end. Yes, we have an option. We can place the Leo plus stand 4.5 to cover the segment and divert the flow to the MCA to take it from the aneurysmal point. Huh? Şükür Гепарин 5000 салып жіберсеңіздер. Бақыт. Лео дұрыс па? 4,5 25 леоны ашып бере салшы. Ашыңыз. Yes, to sleep well, I think it's better to complete the treatment. Керек, аша беріңіз. Бұл басқа васк, бұл 25, аша беріңіз. Анау 21 болды ғой. Okay. Стент ашып салды. Ашып салды. Okay. Yes, it's possible to leave it like this, but then if it would be some problem, nobody knows. That's why it's better to complete the treatment. Sure, that's a 15 minutes, everything is okay. That means that yes, the Vaso CT done 5 cc of contrast and 17 cc of saline like this. And so 1 cc in second injection. It looks, it's nice. Smart mask. Вперед. Один раз. Ослабь. Yes, with the fret extent, it's more precise. With the silk vista, it was precise, but just a millimeter forward. But then we covered the A1 segment. That's why it's a little bit problematic. Huh? Okay, now we change the Vasco 425, which comes inside the box of Leo 4.5. We'll just start from the M1 segment. We don't need to cover the distal part, just this part. Yes. Okay, it's in the lower branch. It's that. Okay. The stand is fully opened. I'm not sure we need the Vaso CT. There is no need for waiting. Yes, now it's better. What? Okay. Stand is fully opposed, it's opened, and now we can take out the Vasco. Don't need Vasco. Sunacağımsa. Okay. Sen ekspresite okudun mu? Buradan komplike mi? Yok. Ha, позитив. Let's do the control, and then we may decide what next. Okay. Так, чуть-чуть контраст пересышь. Чуть-чуть контраст. Yes, now we put this timer, the new timer. Yes, and the Leo stand just stopped before the bifurcation. Just before the bifurcation, and stop. Yes, now the silk stand is a little bit went forward because of the Leo, and also we protected the A1 segment, means ülke içerisinde. Назад, вперед. Yes, now the stand is nicely open. The Leo Plus and the Silk Vista is okay. I will ask Rowan to do Expert CT, and on the minute 15 he will do the last control, but after Expert CT we can finish the live streaming, and then he will do the last control. Okay, let's wait for the Expert CT. Көзіңізді ашыңыз. Бәрі ойдағыдай қорықпай жата тұрыңыз. 15 минутта бітіреміз, Құдай қаласа. Жақсы ма? Okay, dear colleagues, now you can see the expert CT. The brain is clear. The stent is opened. Now we can finish the live streaming, and next 30 minutes we will start the next case. Next case is MCA aneurysm. See you. Thank you.